HIV, or the human immunodeficiency virus, is a virus that attacks the body's immune system. This virus specifically targets and destroys a type of white blood cell called CD4 cells, which are crucial for immune defense. Over time, as HIV kills more CD4 cells, the body becomes more vulnerable to infections and certain cancers that it would normally be able to fight off. Our immune system is our body's defense against infections. It is composed of various cells, tissues, and organs that work together to protect the body from harmful invaders like bacteria, viruses, and other pathogens. White blood cells play a key role in this defense mechanism by identifying and destroying these invaders. When HIV weakens the immune system, it becomes harder for the body to fight off infections and diseases. This can lead to a range of health problems, from minor infections to severe illnesses. People with weakened immune systems are more susceptible to opportunistic infections, which are infections that take advantage of the weakened state of the body. If left untreated, HIV can lead to AIDS, or acquired immunodeficiency syndrome. AIDS is the final stage of HIV infection, where the immune system is severely damaged, and the body can no longer defend itself against infections and diseases. This stage is characterized by the occurrence of certain cancers, infections, or other severe clinical manifestations. Tuberculosis, or TB, is a bacterial infection that primarily affects the lungs. It is caused by the bacterium Mycobacterium tuberculosis. When a person with active TB in their lungs coughs or sneezes, the bacteria are released into the air and can be inhaled by others, leading to new infections. However, TB bacteria can travel through the bloodstream to other parts of the body, like the kidneys, spine, and brain. This is known as extrapulmonary TB. When TB affects these areas, it can cause a variety of symptoms and complications, depending on the organs involved. TB is a serious infection, but it is treatable and curable with proper medication. Treatment usually involves a combination of antibiotics taken over a period of several months. It is crucial to complete the entire course of treatment to ensure that all the bacteria are killed and to prevent the development of drug-resistant TB. Both HIV and TB are major global health concerns, particularly in low-income countries. These regions often face challenges such as limited access to healthcare, inadequate medical infrastructure, and a higher prevalence of these diseases. Efforts to combat HIV and TB in these areas are essential for improving public health outcomes. They often affect the most vulnerable populations, highlighting the importance of global health equity and access to healthcare. Addressing these issues requires a coordinated effort from governments, international organizations, and local communities to ensure that everyone has the opportunity to live a healthy life, free from the burden of these diseases. HIV is spread through contact with certain bodily fluids from an infected person. These fluids include blood, semen, vaginal fluids, and breast milk. HIV transmission can occur through unprotected sex, sharing needles, or from mother to child during pregnancy, childbirth, or breastfeeding. TB, on the other hand, spreads through the air. When a person with active TB disease in their lungs coughs, sneezes, or even talks, they release tiny droplets containing TB bacteria into the air. These droplets can be inhaled by others, leading to infection. It's important to note that HIV and TB are not spread through casual contact. You cannot get HIV or TB from hugging, shaking hands, sharing food, or using the same toilet as someone who is infected. The symptoms of HIV and TB can vary greatly from person to person. This variability can make it challenging to diagnose these conditions early, which is crucial for effective treatment and management. Some people may not experience any symptoms at all, especially in the early stages of infection. This is particularly true for HIV, where individuals can remain asymptomatic for years while the virus slowly weakens their immune system. Early symptoms of HIV can be similar to those of the flu, such as fever, headache, sore throat, and rash. These symptoms often appear within 2 to 4 weeks after the virus has entered the body and can last for a few days to several weeks. As HIV weakens the immune system, people may experience persistent fatigue, swollen lymph nodes, unexplained weight loss, and recurrent infections. These symptoms indicate that the virus is actively damaging the immune system, making the body more susceptible to other infections and diseases. TB typically causes a persistent cough, sometimes with blood-tinged mucus. This cough can last for weeks and is often accompanied by other respiratory symptoms. Other symptoms include chest pain, weakness, weight loss, fever, and night sweats. These symptoms can be severe and debilitating, significantly impacting a person's quality of life. TB can be latent, meaning the bacteria are present in the body but are not active. In this state, the person does not feel sick and cannot spread the bacteria to others. Latent TB infection does not cause symptoms and is not contagious. However, it can be detected through specific medical tests, and treatment is often recommended to prevent the bacteria from becoming active. However, latent TB can become active if the immune system weakens. This is why it is crucial for individuals with latent TB to receive appropriate medical care and monitoring, especially if they have other health conditions that compromise their immune system. HIV attacks the body's CD4 cells, which are white blood cells that play a crucial role in fighting infection. As HIV destroys CD4 cells, the immune system weakens, making the body susceptible to opportunistic infections and cancers that a healthy immune system would normally fight off. TB bacteria primarily attack the lungs, causing inflammation and damage to lung tissue. This can lead to coughing, chest pain, and difficulty breathing. If left untreated, TB can spread to other parts of the body, causing serious complications such as meningitis, which is inflammation of the brain and spinal cord, spinal pain, joint damage, and kidney problems. Section 5. Diagnosis: Identifying HIV and TB. Diagnosing HIV involves a simple blood test that detects the presence of HIV antibodies in the blood. This test is crucial because early detection can significantly improve the management and treatment of the disease. The blood sample is usually taken from a vein in the arm, and the process is quick and relatively painless. Rapid HIV tests can provide results in as little as 20 minutes. These tests are highly effective and can be done in various settings, including clinics, community centers, and even at home. The rapid test uses a small sample of blood or oral fluid, and the results are easy to read, making it accessible for many people. If a rapid test is positive, it is important to confirm the diagnosis with a follow-up blood test. This confirmatory test ensures the accuracy of the initial result and helps in planning the next steps for treatment and care. The follow-up test is usually more detailed and may take a few days to get the results. TB diagnosis can be more complex. Unlike HIV, TB can affect various parts of the body, most commonly the lungs, but also the kidneys, spine, and brain. This complexity requires a multifaceted approach to accurately diagnose the disease. It often involves a combination of tests, including a skin test, a blood test, a chest X-ray, and sputum or phlegm tests. Each of these tests provides different information that helps in confirming the presence of TB. The skin test, for example, can indicate if someone has been exposed to the bacteria, while the chest X-ray can show the extent of lung involvement. The skin test, also known as the Mantoux test, involves injecting a small amount of TB antigen under the skin and observing for a reaction. A raised bump at the injection site within 48 to 72 hours can indicate TB exposure. However, this test alone cannot confirm active TB disease. Early diagnosis of both HIV and TB is crucial for timely treatment and better health outcomes. Early detection allows for prompt intervention, which can prevent the progression of the diseases and reduce the risk of transmission to others. It also opens up more treatment options and improves the overall prognosis for the patient. Regular testing is recommended for individuals at risk of either infection. This includes people with weakened immune systems, those with a history of exposure, and individuals living in areas with high prevalence rates. Community outreach programs play a vital role in increasing awareness and accessibility of testing services, ensuring that more people can get diagnosed and treated early. Section 6. Treatment combating HIV and TB. While there is no cure for HIV, antiretroviral therapy or RT can effectively control the virus and prevent progression to AIDS. ART involves taking a combination of medications daily to suppress HIV replication and keep the immune system strong. With consistent ART, people living with HIV can live long and healthy lives. TB is treated with a combination of antibiotics that must be taken for several months. It is crucial to complete the full course of treatment as prescribed by a healthcare provider, even if symptoms improve, to ensure the bacteria are completely eradicated and prevent the development of drug-resistant TB. Section 7. The global struggle HIV and TB on the world stage. HIV and TB disproportionately affect low-income countries, highlighting the interconnectivity of global health and socioeconomic factors. Poverty, lack of access to healthcare, stigma, and discrimination all contribute to the burden of these diseases. The global response to HIV and TB has made significant progress in recent decades. However, challenges remain in ensuring equitable access to prevention, diagnosis, and treatment services, particularly in resource-limited settings. Section 8. Prevention is key curbing the spread of HIV and TB. Preventing HIV transmission involves a multifaceted approach that includes comprehensive sex education, promoting safer sex practices, making condoms readily available, providing harm reduction services for people who inject drugs, and preventing mother-to-child transmission. TB prevention strategies include early diagnosis and treatment of active TB cases, contact tracing to identify and treat individuals who may have been exposed, and vaccination with the BCG vaccine, which provides some protection against severe forms of TB in children. Public health campaigns play a crucial role in raising awareness, reducing stigma, and promoting prevention measures for both HIV and TB. Section 9. The road ahead: research, awareness, and hope. Ongoing research is crucial for developing new and improved tools to combat HIV and TB. Scientists are constantly working on developing more effective vaccines, easier to take medications, and potentially even cures for these diseases. Raising awareness about HIV and TB, promoting testing, and ensuring access to quality healthcare for all are essential steps towards ending the global epidemics. By working together, we can create a future where everyone has the opportunity to live a long and healthy life, free from the threat of HIV and TB.